Hey guys, welcome to this week's podcast episode. I'm really excited about today's guest, Dia Berger from Canada, and she is with the MedSpa Method Academy. We're going to find out all about that. And I love hearing entrepreneur stories such as hers. She's going to talk to us all about entrepreneurship, personal growth, and give her the platform to inspire the audience. So, Dia, welcome.
Christopher, thank you for having me.
Yeah, I know we connected and through Podmatch, and tell people your backstory, how you got started, and we'll dive right into the conversation.
You got it. I was actually born in Namibia, the country just north of Republic of South Africa, and very rural. My dad was a GP surgeon serving an area about the size of Belgium. So he flew and was known as the flying doctor. And I wanted to be this man my whole life. So when I was 8, I kind of made him show me an autopsy. He was the district surgeon, so he looked after autopsies as well. And that was the day I decided this is going to be my life. And I emulated the man. I got my pilot's license, went into med school, and kind of towards the end of med school in South Africa, things became politically pretty unstable. So, bombings, shootings. So we decided to emigrate. New Zealand first, and then Canada. And Canada's been good to us, but I couldn't quite get back into the surgical aspect. So, contacted a friend at some point who got into the medical aesthetics a year prior. And I said to him, how do we do this? And then I took to it like a bird to flight.
Yeah. Yeah, it's very fascinating story. And I know that, a lot of physician entrepreneurs have got into the med spa space, and kind of talk about what it is about the med spa space, what drew to you, what are the advantages, disadvantages, what to look out for, all of that.
You got it. Good question. And it's a complicated one. Of course, the money I find is what draws everyone, but it's not that simple. There has to be a lot of things put in place because it is medical, and we are doing semi-invasive things with injections. You have to get your training and things in order. And by definition, a med spa needs a physician. And I'm not anti-nurses or nurse injectors. I've actually certified quite a few, but you need that physician, to give it the credibility and the safety ultimately for clients. So it's an amazing area. I have found it so fulfilling that it's almost not a job. I say to my husband, if people knew what a kick I got out of it, they probably would know that they didn't really have to pay me for it.
Yeah. Yeah, that's good. And I know, for example, there's Botox, there's fillers. I know there's peels. There's so many different ways, and I know a lot of people are interested in it. So the other question is, you tell us, what is a med spa? So what are the different types of spas and their history? Kind of talk about that.
Good question. Thank you. So literally what I've started doing is I've created an academy because there's a gap. I found out that there's a gap in the market. You have med schools that teach doctors and nurses, and they teach us medical. There's really nothing cosmetic. There's nothing about lasers or Botox or filler or microneedling. And then you get aesthetic schools training estheticians, but nothing medical. So I ended up in a situation where I was the medical director for 50 spas across Canada. And that number has changed. Overall, I've had the privilege of looking into the guts of probably 100, 120 med spas. And it's usually very proprietary. So, being a mentor has allowed me to see inside them, and you can see what works and what doesn't. And in the end, you can sleek it down to a system that is very, very effective, and it doesn't have to be super complicated. I think it just needs to be safe for clients, and we don't want comebacks, and we don't want negative reviews and things like that. It's what kills you, and it's completely preventable by making sure you've got your team trained and your staff trained. But just because someone's a physician doesn't mean they know how to do this, and neither does an esthetician. So, to get into a bit more detail with your question, the traditional spa looks like a pyramid, heavy at the bottom with aesthetics and very light at the top with injections. And I have found that the successful ones medically flip it around. They make a diamond, so they really focus on injections and lasers and things like that, and kind of forget about the aesthetic part at the bottom. And the true answer is somewhere in the middle. And that is where you hit the balance between the money, the satisfaction, but not burning out your injector, but also not getting stuck in the nitty-gritty and the high energy, low return of the traditional aesthetics.
Yeah. Then the follow-up question is so it sounds like, especially in the US, different rules and regulation, and kind of talk a little bit about quality and licensing. I know kind of general because it's very specific, and speak to that.
Yes, Christopher, good question. It's very different from country to country and state to state. To answer you about the US first, it depends on the state, but the majority of them insist, for example, on it that a physician is a 51% owner. Literally what they're trying to do with that is they're forcing the physician to plug in and to commit and be responsible for quality control and protocols and whatever happens inside the spa. And I completely understand why, because in the end, it is about safety for a client, right? Yes, people might want the money, but rule number one is do no harm. When you get to Europe kind of follows, some countries are more like the US, some are like Canada. In Canada, the medical director has to be a doctor, and then you can have nurses or nurse practitioners as injectors. Where it gets tricky is if you think of filler, which is hyaluronic acid in gel form, the gel, if injected in the wrong place, for example, into a vein, acts as an embolism, right? So you can really harm the patient. So there are, for example, no-go zones when you inject. And to me, it is a case of, I've seen so many comebacks and have had to clean up so much after other injectors. My goal is multifold. Number one is safety for clients, seriously, because you don't want someone going in to look pretty, but she ends up with skin necrosis or, tissue damage. And the other side is, this is not an industry with a cap. There's so much money out there for this. We don't have to have a dog-eat-dog situation where it's, I'm going to take everyone else out, or the spas being so highly competitive. To me, it would be way better if everyone just did it well, right? It'll make them more lucrative. And in the end, we win and the customer wins, which is ideal.
Yeah. Yeah, it's so true. And, it's always terrible when somebody goes in for an elective and then comes out with a disaster. We see this in surgery, and, if you don't, like I said, anything that's, you don't want to do harm, and just like, especially something that's not necessary, just kind of cosmetic or elective or.
Correct. Yeah. And, if I can tell you a quick story there. So many years ago, I was on the sideline involved in a situation in the town that I lived. A regular spa, did a pedicure on a diabetic, and this is not a bad spa at all. But not being medical, right? They don't have an intake form. So nobody knew she was diabetic, and this lady was in her mid-40s, got the pedicure, and they did the blading on her foot. Now, you and I immediately have goosebumps when they say that to a diabetic, because their immune system can't fight an infection. So they cut her. A tiny nick got infected. She ended up in the hospital in ICU, but they couldn't get the infection under control, and she ended up with a below-knee amputation. That is terrible, but it does happen. So even though it is a minor thing, it can have catastrophic results, which is where I feel that someone like my calling, call it that, is to help prevent those kinds of things, right? That just get, again, they're the esthetician training a little bit more medical, that we don't get people in trouble.
Yeah, like I said, life limb function is what would, preserve life, preserve limb, and then preserve function.
Absolutely.
Yeah. And so kind of talk about this idea of some of the biggest challenges for med spa owners.
Challenges for MedSpa owners. That's a long list. I'm going to tell you burnout is probably number one. If you do a good job, you are running as a full-on business owner, which is a big job, which means you have to, stay up on your marketing, keep it fresh, keep it interesting, keep people coming back. And then you're also running as a medical director. That is, if it is a physician, if it's not a physician, those two people need to work really closely in conjunction with each other. And I call it a plugged-in medical director. A physician just showing up at a spa 2 days a week and leaving isn't good enough. But the challenges are huge. I take it from myself. I've done this for about 20 years. And there was a period of time where you're 20 pounds overweight. Can't remember when last you slept. You're trying to get your family organized. I was working in a clinic, and I'm a pretty creative person and I'm good with my hands. But to make it run really, really well is a massive job. And I find that spa owners they're lonely. They feel like they're in a vacuum. They don't know who to ask for help. And my conclusion after having done this for many years is so many of them, they don't even know what it looks like. And I call it the Fabergé egg, right? I feel I've reached a point, and with all that experience, where I can show them, this is your goal. This is actually what we want. Now let me show you how to get there. Because so many of them are flailing in the middle. You try and learn Botox injections. So you go to a course, but you don't know if the course is good, bad, or indifferent, right? And then you go to the next one, and it's in another state or another country. So you have to educate yourself and your injector and hope that what you go to or learn is actually worthwhile. And it isn't always, right? And that's kind of what I've been trying to do, is just to get, after 20 years, the good information, the effective, the true information in one place and go, okay, here's the answer. Now let's go do a good job.
Yeah. So well said. We kind of talked about, med spas, for the audience out there, if they want to hear more about specific systems or traditional med spa methods, suboptimal, but we want to transition into kind of overcoming adversity and turning it into triumph, these entrepreneurial stories. So kind of talk about, your journey, and especially, from, different, especially, trying to get, licensed and credentialed in different jurisdiction is complete mess. Sometimes you have to start over. And so kind of talk about overcoming adversity, turning it into triumph.
Okay. Well, in South Africa, we're trained as GP surgeons, so it's the North American MD, but then you've got a base surgical degree as well. Because over there, we've got 10,000 patients per doctor, where in North America, it's 1,000 to 1. So we're used to doing anesthesia and, basic surgery, which I love. And then you come to Canada, and if you go to really remote areas with a South African degree in the late 90s, they would let you do those, but not in big cities. So I actually tried to specialize in Canada. I did a couple of rounds, but at that point, foreign grads were not allowed to participate in level 1. So they had the Canadian grads, have first choice. And what would be left over would be family medicine. And I'm like, got that, or oncology. And I'm like, it's so not my mental makeup. I won't be a good oncologist. So, I got into the injection, cannula work, that kind of thing, because it allows me to do some procedures, but I don't have to go to the rural areas or whatever to be the surgical part. And in the beginning, it was quite a fight, in the sense that I didn't know enough. It's one of those, you don't even know what you don't know, which means I take guidance from the business mentor, and he was fantastic. And I injected really, really well. But after years, I realized that the model in Canada, for example, in the East and the West is quite different. The East of Canada are super focused on aesthetics. They do manicures, pedicures, facials. They tack on lasers. They tack on injections kind of as an afterthought. which was the model that was given to me. It's literally like, you need to do this percentage product, this percentage traditional, this percentage injection. And off the bat, I injected too much. But the message to me, that's in italics, the message to me from the people in charge were, your staff is weak, right? You need to train your staff better because they're not selling product enough. They're not doing enough services, which means I buttoned down and really trained them. But in the meantime, I'm also training, I'm going to more seminars and things, and I'm getting better and better and better. So my staff's doing better, but I'm doing better as well. And instead of a diamond, my numbers formed this mushroom, right? That's top heavy. And then I get told by the East again, go better, do better. Your sales are not good, right? So I became really, really good at teaching staff. And about 3 years into it, they actually analyzed 50 spas in this group across Canada. And he phoned me up and he said, I have to put this in perspective. And he said, you're not just artificially injecting a high number, you're really injecting a high number. And at that point, I was injecting double per capita what my colleagues were. And that was from 4 spas in Vancouver, 4 in Calgary, 6 in Toronto, all across the country. So I do have a knack for it. And I think part of it is love for it as well. But I literally went from fighting this diamond, this pyramid shape, and giving up on it and making the diamond, which I found since, a few of my colleagues do as well. But then the business advisor said, I need for you to go to the other spas and whatever you're doing in yours, duplicate it, right? Which is how I got into that training situation. But I was still injecting in my own. So I would fly to different places in Canada, look at what they're doing, make a game plan, discuss it with the manager. We'd start putting things in place. And then I would go back because I have to keep my own going. And they would fly their injectors to me and their senior staff to me because I didn't want to be licensed in every province, which means we would do the hands-on procedures and things at my place. And I'd certify the injectors and their senior staff, and they'd go back. So there were a few years where I said to my husband, it's like years just disappeared. I don't know where they went. It seems like I lived for Friday night, which was movie night and wine gums, right? But I think it's taken me 5 years to make up on sleep. And it is hard work. But because I love it and I'm a bit of a bloody-minded personality, I will push until it's done. But it's been hard. I don't regret it for a second. In there, I think I was a good mama. There were days where, most days, I would start early. I would make sure I pick up kids from school because that's when they tell you all the magic stuff, right? What happened in their day. We'd do dinner and then I'd go back to inject and my husband would put the kids to bed. So I had this chopped up life. And the hardest thing for me was going from full on injecting, selling to jump on the trampoline in my fancy clothes, right? And then go back to the spa again. But, in the end, you have massive experience, which I wouldn't exchange for anything. But I did get to a point where we had the discussion in our house and I said to my husband, work is easy and vacation is hard. And that's where I knew I needed to throttle back, right? You're getting addicted to the adrenaline rush and you can't relax anymore.
Yeah. Interesting. There's so much to cover, and we may have you back for follow-up guests. How can people contact you, follow you, reach out to you, check out your work, etc.?
To contact me directly, easiest is email. I've got it's simple. It's $1,000,000spa@gmail.com. No dots or anything strange in there. And I do offer a free consult, for spa owners. Just talk to them and see if I can help. And I can send people a few free videos if that's something that fits in with your plan and your method. And I am on LinkedIn. That's probably the easiest ways to find me.
Yeah. And for all the audience out there, let's thank for Dia for coming on. Interesting conversation about med spas, adversity. All of our resources will be in the links and show notes. And thanks so much for coming on to the podcast.
Christopher, thank you for having me. It was a blast. You're a lovely host. Thank you.